This is Real History with Melissa. Today is the 15th of January, 2026. I hope that you are all doing well. This is the first installment of a series that has been created for us by Mike in Canada. And Mike in Canada is the one who, in late 2021, came up with the idea of doing the excerpt series. And he started those as audios and then later added video to them. He did many great excerpts of Alan Watt talks. And I have done a couple of real histories with him, which were also unique. He approached me with the idea. He actually created them. And so they were different from the kinds of things that I have done, but very interesting. Those were Over the Mountain, 2 of them. And I'll give you links for those if you haven't seen them. They're well worth watching. He also created the special Christmas Redux for 2024, and it was beautiful. He made a beautiful video. I just love it. So that is Mike in Canada, and he came up with the idea to give us the COVID-19 timeline. And I think that there are a lot of reasons why this is a good idea. He didn't want to introduce it, and I'm going to be not giving much of an introduction here either, because I think it's good for you just to see what he has done, remind yourself of some things, and kind of in a way you can immerse yourself into the timeline. And I think this is a good exercise for a lot of reasons. So what he has done is used just news coverage of COVID-19 as it unfolded, and you'll see that it's day by day. He gives us the date with each change of date video. So for every day of the month, pretty much, I think, there is some news coverage that happens. So we follow a timeline. And I will not be making these available in audio form because just too much is lost in translation. You need to see it, and they are relatively short. I think they average about 17 minutes in length. And so it's good to just take it in, put yourself into the timeline, and see it unfold. It may be when the series is done running that either Mike or myself or both of us together want to give some kind of comment on it. But for now, you'll just watch and hopefully learn and enjoy. I would like to do these once per week. They may not always come on Thursday. It depends on what I have lined up. But it may be an extra thing in the week. And so here is January 2020 from the COVID-19 timeline. Thank you.
City of Wuhan in Hubei province. Authorities say it is untrue and no person-to-person transmission has been found so far. The statement comes after 27 cases of viral pneumonia were reported earlier this week. All the cases were found to be related to a seafood market, and it led to rumors spreading on social media about an outbreak of SARS. That's a highly contagious respiratory disease. Police have warned that fabricating rumors and spreading them are against the law and will not be tolerated. Chinese health authorities are still working to identify the virus behind a pneumonia outbreak in the central city of Wuhan. According to authorities, the number of cases has increased to 44, with 11 of them in serious condition.
Hong Kong reported 2 more cases linked to Wuhan flu, bringing the city's total cases to 5.
Don't you?
Some 59 people in Wuhan have come down with the virus. Hong Kong has activated a newly created serious response level as the number of affected patients jumped to 15 on Sunday. Singapore's first suspected case, a 3-year-old girl with a history of travel to Wuhan, is not linked to the cluster there. It turns out she has respiratory syncytial virus. Singapore experts told the Straits Times that there is no need to cancel trips to Wuhan, but to monitor and the Health Ministry's advice.
Well, Chinese authorities were a bit more definitive compared to the WHO. It said that Chinese experts reportedly found a new coronavirus that traces back to the outbreak that we are seeing in Wuhan. And it said that the researchers on Tuesday, after analyzing samples collected from the cases, said that they had obtained the genetic sequencing of the virus from one of the patients and then verified that 15 patients tested positive for this specific virus. And the report also said that while it usually takes several weeks to identify this genetic sequencing in patients, it would take much longer, possibly even years, to come up with a vaccine for the virus and any sort of drugs or medication to cure the disease as well. And so
China's state-run Xinhua news agency reported a team of scientists identified the new type of coronavirus after tests were run on the 59 people who have been hospitalized since early December. The World Health Organization issued a statement confirming the preliminary discovery of the virus. Health officials in Hong Kong say as many as 38 people have been hospitalized in recent days after returning from Wuhan with flu or pneumonia-like symptoms. The virus can lead to sudden acute respiratory syndrome, commonly known as SARS, which struck China and Hong Kong in 2002 and 2003, killing nearly 800 people and affecting more than 8,000.
Local health authorities say one patient with viral pneumonia has been confirmed dead in Wuhan, China, and 7 others were in critical condition. Tentative diagnoses show 41 people suffer from pneumonia caused by a preliminary determined new type of a coronavirus by Friday. The others were in stable condition, among which 2 have been discharged from hospital.
A mysterious pneumonia outbreak in the Chinese city of Wuhan that sickened dozens of people may be a virus that's from the same family as SARS. According to South China Morning Post, researchers from China and Australia concluded that the new type of coronavirus is about 80% similar in genetic structure to the SARS virus, which killed hundreds of people in China and Hong Kong a few years ago. Now, coronaviruses cause respiratory and intestinal diseases. A Chinese researcher said the new coronavirus may have originated in bats and then spread to other animals and humans at a now closed fish market in the city of Wuhan.
I think it's fair to say that I found your presentation maybe the most exciting at the entire conference. And one of the reasons is because you have a new class of medicine.
Well, thank you, Jim, for having me, and thank you for your nice comment. Yes, we are very excited. Since we started Moderna now 8 years ago, the vision has always been very crisp. It has been, if we can make messenger RNA work safely in humans, it will be a very broad platform, a new class of medicines where we can go after cancer, infectious disease, rare disease, and many more.
many people have RNA and it's all on the drawing board. It's all whiteboarded. It's frankly not ever going to get to us, I think. You are incredible. You got going to phase 3 on what could be a $2 to $5 billion opportunity now.
Yes, so we are very excited. We have a vaccine. We just presented the clinical data last week against CMV, cytomegalovirus. It's a virus that, if it infects a woman during pregnancy, will be transmitted to the baby and will have massive, impact on the brain development of a baby. It's the #1 cause of birth defect in this country.
Number one.
People
who've not heard of CMV need to know that you're attacking something big, not orphan.
Correct. Very big. And we believe that every woman in the age of bearing a child in this country should get vaccinated once, hopefully, this vaccine gets launched.
It reminds me of...
According to a statement by Thailand's Public Health Ministry, the second patient is a 74-year-old woman from Wuhan in China, and she has been detected on January 13th at Bangkok Suvarnabhumi Airport with very high fever, 38 degrees Celsius, and pneumonia-like symptoms. But she has been put under isolation, but she's already responding well to the treatment, according to the health officials here. Now, this comes after the first case that has been reported earlier this week in Thailand, which is also the first case of the Wuhan coronavirus outside of China. Similar circumstances as well. It is also an elderly Chinese woman here as well, 61 years old to be precise, but she is already well reportedly, and it's just a matter of time until she's ready to go home already.
January is the peak travel season from China to the United States because of the Chinese Lunar New Year. So that's why the Centers for Disease Control and Prevention are taking this highly unusual step in screening passengers at 3 airports, including JFK, for symptoms of a mysterious new virus. Passengers arriving from Wuhan, China will be checked for symptoms of fever, coughing, and difficulty breathing. Screenings at JFK will start tonight. So far, 2 people in China have died from this new virus, officially called the 2019 novel coronavirus. 41 others have been infected.
Concern is growing over a possible outbreak of a new SARS-like virus. The flu-like mystery illness first reported in China, already spreading to Japan and Thailand.
The global community is very familiar with what has happened with SARS in the past, and this is something that is on our radar.
Now federal officials south of the border are on alert. Some American airports have begun screening passengers flying from central China for the virus that has killed 2 people and sickened dozens more.
So let's just break that down for you. In Wuhan, we are seeing the 3rd death that's being reported. The first 2 deaths were reported over the last 2 weeks. The earlier 2 deaths were of a man in their 60s, and they both had underlying medical conditions. We have not heard any further details on, this 3rd victim of this pneumonia outbreak. Now, of the new 136 cases, we are hearing that the youngest patient is 25 years old, while the oldest is 89. And symptoms displayed include fever, cough, and they have difficulty breathing as well.
Word that the coronavirus has spread beyond the city where it was first detected has health officials in China and now around the world on notice. And that includes here in Canada, where some of the things that need to be put in place are happening. With every flight from China, this country is now on watch for the coronavirus, now that it's on the move. Canada watching for signs of sickness at airports in Toronto, Vancouver, and Montreal. An outbreak beyond the city of Wuhan, where it was first detected, has now spread to Thailand, Japan, and South Korea with people who had recently been there. By Monday, over 200 cases had been reported with 3 deaths.
At least 6 people have died in an outbreak of the new coronavirus, which has now reached the United States. The Centers for Disease Control and Prevention has confirmed the first U.S. case has been detected in Washington state. The patient, who is in isolation, recently returned from Wuhan, China, where the SARS-like respiratory illness was first detected last month. Authorities there are spraying disinfectant on the streets. And today, the city revealed a series of new measures in the race to contain the deadly virus. They include the cancellation of upcoming Chinese New Year celebrations, the busiest travel season in the country. And today, the World Health Organization warned the coronavirus is likely to spread.
All eyes are on a new strain of a coronavirus. The outbreak of this new virus is linked to a seafood and animal market in Wuhan, China.
It's a coronavirus, and it's likely that this originated in some non-human animal and jumped from a non-human animal into a human.
Now, health officials believe the virus is spreading through human-to-human contact. The first reported case of this new virus was on December 31st, 2019. So what is a coronavirus, and what do we know so far about this new strain?
So there's a fairly wide spectrum in terms of clinical illness. It does sound like a lot of the cases can be mild. There are definitely some more severe cases, and those can be pneumonia, or they can lead to respiratory failure, and there have been a few deaths. But the symptoms are really non-specific, so they're a lot like what we would see with influenza virus. So those are things like fever, dry cough, sore throat, muscle aches, headaches, those kind of things. So unfortunately, there's no specific symptom associated with this particular virus.
We had someone who was sick on the aircraft.
Tonight in Baltimore, a coronavirus scare. Medical officers escort a sick passenger off of a Southwest flight from Las Vegas. The passenger had recently been to Beijing.
Because of this heightened time, we're just using an abundance of caution.
The airline in a statement saying, in light of the recent concerns of the coronavirus, our crew followed recommendations from the Center for Disease Control. The Maryland Department of Health later saying the passenger ultimately did not meet the CDC's criteria for coronavirus testing. The extra precaution symptomatic of a nation on edge after 2 confirmed coronavirus cases. One of them in Chicago, where a 60-year-old woman is in isolation, but in good condition.
Well, we continue to learn more about Canada's first presumptive case of the coronavirus. And here's what we know so far about the Toronto patient. Now, he is a man in his 50s whose name has not yet been released, but he did travel from Wuhan, China to Toronto by way of Guangzhou. He landed in Canada on Wednesday aboard China Southern Airlines flight CZ311. Lab results to confirm the case are expected in the next 24 hours.
So coronavirus is a group of viruses, a family of viruses. They have their big RNA viruses. They have actually some of the biggest RNA genomes of any virus. They predominantly cause respiratory disease in humans. Right now, all diagnostic testing is being sent to the state public health labs and being coordinated through local public health authorities, and also being sent to the CDC. So right now we don't perform clinical testing because that's supposed to be done by the public health authorities. But in the case that there is more transmission, we have to be ready for that because it does take a little bit of time to get these things up and running.
Tonight, the CDC is expanding its travel warning, urging Americans to avoid non-essential travel to all parts of China, not just the outbreak's epicenter. A senior administration official says the White House is considering more travel restrictions. Tonight, Americans are scrambling to get out of Wuhan, China on a charter flight organized by the State Department.
I'm more than a little concerned about what would happen if one or both of us got sick and had no way to get to the hospital.
For Jacob Wilson from Louisiana, who's working at a tech startup there.
Don't cry, don't get too close.
A heart-wrenching realization. No space for him on the flight out.
there's a bigger plane that could fit everybody, I definitely want to be on it.
I'm clinical psychologist Dr. Ali Matu, and in this video, I'm going to show you how to deal with coronavirus anxiety. When I was an assistant professor at Columbia University, I treated a lot of anxiety related to public health scares, stuff like swine flu, Ebola, the West Nile virus. The patterns that played out with those viruses are a similar pattern to what I'm seeing now with the coronavirus. I'm going to show you how to stay safe in the face of this outbreak while also coping with and dealing with the anxiety that comes up as a result of it.
We've been hearing a lot of questions about the Wuhan coronavirus. For example, should I buy a mask? Or should I be wearing a mask? Singapore's Ministry of Health actually says that you should only be wearing a mask if you're feeling unwell and need to go and see the doctor. The mask using the ear loops, taking care not to touch it, and then dispose of it in a bin. Then wash your hands thoroughly. Perhaps more important to keep yourself from falling sick is to wash your hands properly after touching surfaces in common areas. According to the CDC, follow these 5 steps to wash your hands the right way.
Today, President Trump took decisive action to minimize the risk of the spread of novel coronavirus in the United States. I have today declared that the coronavirus presents a public health emergency in the United States. Any U.S. citizen returning to the United States who has been in Hubei province in the previous 14 days will be subject to up to 14 days of mandatory quarantine to ensure they are provided proper medical care and health screening.